Algeria International. It's time for the news.
Algeria pleaded in New York for the adoption of a new approach aimed at relaunching the peace option and achieve a fair and inclusive settlement to the Palestinian cause. Human Rights Watch has reported that the Moroccan authorities systematically violated the human rights of the Sahrawi people in the occupied territories of Western Sahara in 2023. UN Secretary General Antonio Guterres has told the Security Council on Tuesday that the Zionist entity's rejection of the two-state solution with an independent Palestinian state is unacceptable. Those were the major developments. Now the full news edition. Good afternoon. The Minister of Foreign Affairs and the National Community Abroad, Ahmed Attaf, has held a number of bilateral meetings at the United Nations in New York with counterparts including representatives of member and non-member states of the Security Council, notably Russia, Indonesia, Iran, Jordan, Malaysia and Lebanon, as part of his main mission in New York, which it had been entrusted to him by the President of the Republic, Abdelmajid Tebboune, to take part in the Security Council's high-level debate on the Palestinian question. Algeria pleaded in New York for the adoption of a new approach aimed at relaunching the peace option and achieve a fair and inclusive settlement to the Palestinian cause, stressing the imperative of responding firmly to the Zionist cause, openly rejecting the two-state solution, supported by the international community as a fair, viable and definitive solution to the conflict in the Middle East. This statement was made during an address by the Minister of Foreign Affairs and the National Community Abroad, Ahmed Attaf, before the Security Council meeting convened to examine the situation in Palestine, particularly in the Gaza Strip, victim of an iniquitous Zionist aggression. More with Asya Bakar.
At the start of his address, Foreign Minister Ahmed Attaf conveyed a message of recognition and gratitude from the President of the Republic, Abdelmajid Tebboune, to the Secretary General of the United Nations, Antonio Guterres, and to all UN bodies for their tireless efforts to alleviate the tragedies that have befallen Gaza, to heal its wounds and to stop the bloodshed. This is a message of support and recognition, added Ahmed Attaf, to the unceasing efforts made despite criticism and attempts to undermine their credibility and authority through acts of provocation and blackmail by an occupation that believes itself to be invincible.
Algeria hails the brave and courageous initiatives that quit practices that privilege ones over others to force the Israeli colonizer to shoulder its responsibilities. I refer particularly to the initiative of the President of the Republic, Abdelmajid Tebboune, that gathered judicial experts and international human rights organizations in order to sue the Israeli colonizer before international bodies and put an end to decades of the latter's unaccountability for its crimes. I also refer to the initiative of South Africa to take the Israeli colonizer to trial at the International Court of Justice for its genocidal war against Gaza. I refer to the initiative of Chile and Mexico as well.
The minister maintained, "We are called upon in these decisive hours to counter the illusions which the colonialist Zionist occupier feeds to strengthen its security by annihilating the Palestinian national project." He added, "We must also counter the annexation of Palestinian land and the establishment and expansion of Jewish settlements in an attempt to prevent the establishment of an independent and sovereign state of Palestine." Ahmed Attaf also underlined that it is equally imperative to suppress the occupiers' impunity and its illusions about resurrecting the greater Israel project out of the ashes and rubble of the Palestinian national project. In the light of all these considerations, Algeria has reaffirmed through its Minister of Foreign Affairs its historic demand to hold an international peace conference under the aegis of the United Nations, where it will be agreed to put a definitive end to the Arab-Israeli conflict.
Algeria reiterates her historic request to hold an international peace summit under the aegis of the United Nations to agree on a definitive end to the Arab-Israeli conflict by implementing the decisions of the international legality, notably the two-state solution, under the firm supervision and strict monitoring and guarantee of the international community. And after the current war on Gaza, the Palestinian cause cannot go back to where it was and stay marginalized for more years. After the current war on Gaza, the international efforts cannot focus only on the consequences of the war while turning a blind eye to the root causes of this war.
In this connection, the Minister of Foreign Affairs called on the UN and Security Council to respond firmly to Israeli voices loudly proclaiming their rejection of the solution and the two positions that flout the international consensus and denigrate international legality.
Human Rights Watch has reported that the Moroccan authorities systematically violated the human rights of the Sahrawi people in the occupied territories of Western Sahara in 2023. In its 2024 report, Human Rights Watch stressed that the Moroccan occupying authorities muzzled the Sahrawis' human rights and independence activists by harassing them, spying on them, and in some cases by sentencing them for long terms of imprisonment. The report cited the case of the 19 Sahrawi people still in prison following their sentence after two unfair trials in 2013 and in 2017 for peacefully protesting for the right of the Sahrawi people for self-determination. In its report, Human Rights Watch said that the sentence of the trials were only based on the confession of the arrested Sahrawis made to the police, with no serious investigation regarding the allegation on the so-called confessions said to be made under torture. Human Rights Watch has recalled that Western Sahara is considered by the UN a non-autonomous territory occupied by Morocco in 1975 following the departure of the Spanish. And now dozens of civilians have been killed and others injured in the ongoing bombardment of the city of Khan Yunis in the southern Gaza Strip as the savage Zionist aggression on the Gaza Strip marks its 110 days. The number of people killed since the beginning of the Zionist aggression on the Gaza Strip on October 7th has risen to around 25,450. At least 63,000 people have been wounded, mostly children and women, while thousands of others are reported missing. According to medical sources, at least 50 people were killed and nearly 120 injured after Zionist forces shelled the western areas of Khan Yunis during the past 24 hours. The NGO Doctors Without Borders expressed its concern for the safety of those inside Nasser Hospital due to the ongoing shelling in its vicinity, underlining that they must be protected and allowed to leave if they want. The organization said it is impossible for the wounded individual to reach the organization as a result of the ongoing shelling. Addressing the Security Council meeting on the situation in the Middle East, including the Palestinian question, the Palestinian Minister of Foreign Affairs and Expatriates, Riyad al-Maliki, said that dozens more civilians in Gaza will be killed in the hours that this council meets, and thousands more as the council continues being prevented from calling for an immediate ceasefire, noting that these atrocities shock and shame the human conscience. More details in this report by Said Bouazi.
In his remarks to the UN Security Council, Riyad al-Maliki painted a grim picture of the Zionist deadly aggression against the Palestinian people, which he said continues unabated and is taking thousands of innocent civilian lives, destroying everything in its path and threatening regional and international peace and security. This is not the result of a natural disaster or a regrettable consequence of war. It is rather a premeditated effort to inflict maximum pain on the Palestinian population, he underlined. Israel has unleashed the most savage and indiscriminate bombing campaign since the Second World War. Further, it has imposed a cruel siege on Gaza, leading to famine, dehydration, disease, and despair, and its actions have led to forcible displacement at a scale and speed not witnessed in modern history. No home, hospital, school, mosque, church, or UNRWA shelter is safe from Israel's bombardments, he declared, pointing to 2,000-pound bombs dropped with no care whatsoever for civilian lives. More than 25,000 civilians had been killed, including over 11,000 children. More than 63,000 had been injured. Thousands have been permanently maimed or disabled, and more than 7,000 have been buried under the rubble, Al-Maliki told the UN Security Council. From Kampala, where the Global South was gathered, to Brussels, where Arab ministers met their European counterparts, to the United Nations in New York, the world is calling for an immediate humanitarian ceasefire, he said, juxtaposing the will of the international community with the whims of a Zionist prime minister driven by a single goal, his own political survival at the expense of the survival of millions of Palestinians. Israeli leaders, he said, do not see our people as an empirical and political reality to coexist with, but as a demographic threat to get rid of through death, displacement, or subjugation. There are only two paths ahead, he stressed, one that starts with Palestinian freedom and leads to shared peace and security in the region, or one that continues denying this freedom and dooms the region to endless conflict, said Al-Maliki.
Palestinian President Mahmoud Abbas has again ruled out during a meeting with a delegation from the Church's Middle East Peace Council any possibility of dealing with the plans of the Zionist entity and its allies to separate Gaza from Palestine. Mahmoud Abbas also reiterated the Palestinian Authority's total rejection of the forced displacement of Palestinians and stressed the need to put an end to the current Zionist aggression against the Palestinian people by establishing an immediate ceasefire in Gaza. And now the UN Secretary-General Antonio Guterres had told the Security Council that the Zionist entity's rejection of the two-state solution with an independent Palestinian state is unacceptable and risks prolonging the conflict.
In recent days, the military offensive has intensified in Khan Yunis with many additional casualties. The entire population of Gaza is enduring destruction at a scale and speed without parallel in recent history. Nothing can justify the collective punishment of the Palestinian people. A lasting end to the Israeli-Palestinian conflict can only come through a two-state solution. Israelis must see their legitimate needs for security materialized, and Palestinians must see their legitimate aspirations for a fully independent, viable and sovereign state realized in line with United Nations resolutions, international law and previous agreements. Israel's occupation must end. Last week's clear and repeated rejection of the two-state solution at the highest level of the Israeli government is unacceptable. And this was despite the strongest appeals from even the friends of Israel, including those sitting around this table.
The EU High Representative for Foreign Affairs and Security Policy, Joseph Borrell, has said that Israel cannot veto the right of Palestinians to self-determination. He said during a joint press conference in Brussels that the UN has repeatedly recognized the right to self-determination of the Palestinian people, underlining that no one can deny or oppose that right. And now the US Armed Forces announced that they had carried out 2 new strikes against the Houthis in Yemen, saying they had targeted anti-ship missiles on the ground aimed at the Red Sea. The new strike hit 2 Houthi anti-ship missiles that were aimed at the southern Red Sea and were ready to be launched, wrote the US Middle East Military Command on X. And now, for his part, the Foreign Minister of Norway has called for the creation of a Palestinian independent state and an immediate ceasefire.
We are here to say that, like my Slovenian colleague, we need an immediate ceasefire. We need a rapid upscaling of humanitarian efforts. We have an appalling, tragic humanitarian situation in Gaza, and we are also, of course, also increasingly worried about developments in the West Bank and beyond, the risk for a regional escalation. So these issues are paramount and immediate, but they are not solutions. The solution requires a political process. And it requires a political process that leads us to Palestinian statehood, not any Palestinian statehood, but a Palestinian state that covers the territory of the West Bank and Gaza, that is run by the Palestinian authorities, by the Palestinian institutions that have been built under the Oslo process.
34 people have been found dead and 10 others have been reported missing following a landslide that hit China's southwestern mountainous region. According to public media, China's President Xi Jinping called on the emergency services to do its utmost to limit the number of victims. And now I invite you to listen to our health magazine compiled and presented by Mohamed Khatil. Thank you for listening.
Hello and welcome to this new edition of your weekly program, The Health Magazine. The week between January 22nd and January 28th is Cervical Cancer Prevention Week. This Prevention Week is a dedicated awareness campaign aimed at educating people about cervical cancer, its prevention, and the importance of regular screenings. Cervical cancer is a largely preventable disease, and this week serves as a reminder to prioritize cervical health and take steps to reduce the risk of this type of cancer. Cervical Cancer Prevention Week has been observed for many years and has played a crucial role in raising awareness about cervical health. It was established to honor the memory of Jade Goody, a well-known British reality television star who tragically passed away from cervical cancer at a young age. Her story highlighted the importance of early detection and prevention. Despite being a preventable and curable disease, cervical cancer is responsible for a large burden of suffering in women around the world, especially in low and middle-income countries. To uphold the right to health for adolescent girls and women, it is important that disparities in access to high-quality health services are addressed. Cervical cancer develops in a woman's cervix, which is the entrance to the uterus. Almost all cervical cancer cases, or 99%, are linked to infection with high-risk human papillomavirus, HPV, an extremely common virus transmitted through sexual contact. Although most infections with HPV resolve spontaneously and cause no symptoms, persistent infection can cause cervical cancer in women. Cervical cancer is the sixth most common cancer in women in the Eastern Mediterranean region. Now, what are the causes of cervical cancer? Human papillomavirus, HPV, is a common sexually transmitted infection which can affect the skin, genital area, and throat. Almost all sexually active people will be infected at some point in their lives, usually without symptoms. In most cases, the immune system clears HPV from the body. Persistent infection with high-risk HPV can cause abnormal cells to develop, which go on to become cancer. Persistent HPV infection of the cervix, if left untreated, causes 95% of cervical cancers. Typically, it takes from 15 to 20 years for abnormal cells to become cancer, but in women with weakened immune systems, such as untreated HIV, this process can be faster and take 5 to 10 years. Risk factors for cancer progression include the grade of oncogenicity of the HPV type, immune status, the presence of other sexually transmitted infections, number of births, young age at first pregnancy, hormonal contraceptive use, and smoking. How to prevent cervical cancer? Boosting public awareness, access to information and services are key to prevention and control across the life course. Being vaccinated at 9 to 14 years is a very effective way to prevent HPV infection, cervical cancer, and other HPV-related cancers. Screening from the age of 30, 25 years in women living with HIV can detect cervical disease, which when treated also prevents cervical cancer. At any age with symptoms or concerns, early detection followed by prompt quality treatment can cure cervical cancer. The head of the International Agency for Research on Cancer Screening Group at the World Health Organization WHO, Dr. Partha Basu, gives us an overview of the world burden of cervical cancer and how IARC is working to eliminate this preventable disease.
Cervical cancer is a major killer disease among women. Every year, more than 300,000 women die of this cancer, and unfortunately, more than 80% of those women are from the low and middle income country. This is all the more tragic because this is a cancer that can be fully prevented by vaccination of the adolescent girls and screening of the women. At IARC, we have several research projects that are aimed at improving the access to vaccination and cervical cancer screening. We have a project that is looking at the efficacy of a single dose of the HPV vaccine. As you know, currently the vaccine is recommended for 2 doses, but then our early results show that even single dose can be as efficacious as 2 doses. This will bring down the cost and the complexities of the program. We have research projects that are looking at different alternative screening tests, the technologies to treat cervical precancers in an affordable and simple way, and we also have research projects that are aimed at improving the quality of cervical cancer screening around the world. This project we call Cancer Screening in 5 continents. We share the outcomes of our research with WHO so that the evidence can inform policies and guidelines all over the world.
HPV vaccination and other prevention steps. As of 2023, there are 6 HPV vaccines available globally. All protect against the high-risk HPV types 16 and 18, which cause most cervical cancers and have been shown to be safe and effective in preventing HPV infection and cervical cancer. As a priority, HPV vaccines should be given to all girls aged between 9 and 14 years old before they become sexually active. The vaccine may be given as 1 or 2 doses. People with reduced immune systems should ideally receive 2 to 3 doses. Some countries have also chosen to vaccinate boys to further reduce the prevalence of HPV in the community and to prevent cancers in men caused by HPV. Other important ways to prevent HPV infection include being a non-smoker or quitting smoking, using condoms in addition to voluntary male circumcision, cervical screening and treatment of precancers. Women should be screened for cervical cancer every 5 to 10 years, starting at age 30. Women living with HIV should be screened every 3 years, starting at age 25. The global strategy encourages a minimum of 2 lifetime screens with a high-performance HPV test by age 35 and again by age 45. Precancers rarely cause symptoms, which is why regular cervical cancer screening is important even if you have been vaccinated against HPV. Self-collection of a sample for HPV testing, which may be a preferred choice for women, has been shown to be as reliable as samples collected by healthcare providers. After a positive HPV test, a healthcare provider can look for changes on the cervix, which may develop into cervical cancer if left untreated. Treatment of precancers is a simple procedure and prevents cervical cancer. Treatment may be offered in the same visit or after a second test, which is especially recommended for women living with other health conditions. Treatment of precancers are quickly and generally painless, causing infrequent complications. Treatment steps include colposcopy or visual inspection of the cervix to locate and assess the lesion, followed by thermal ablation, which involves using a heated probe to burn off cells. Cryotherapy, which involves using a cold probe to freeze off cells, and leads large loop excision of the transformation zone, which involves removing your abnormal tissues with an electrically heated loop. And a cone biopsy, which involves using a knife to remove a cone-shaped wedge of tissue. Early detection, diagnosis, and treatment of cervical cancer. Cervical cancer can be cured if diagnosed and treated at an early stage of disease. Recognizing symptoms and seeking medical advice to address any concern is a critical step. Women should see a healthcare professional if they notice unusual bleeding between periods, after menopause or after sexual intercourse, increased or full-smelling discharge, symptoms like persistent pain in the back, legs, or pelvis, weight loss, fatigue and loss of appetite, and swelling in the legs. Clinical evaluations and tests to confirm a diagnosis are important and will generally be followed by referral for treatment services, which can include surgery, radiotherapy, and chemotherapy. as well as palliative care to provide supportive care and pain management. Management pathways for invasive cancer care are important tools to ensure that a patient is referred promptly and supported as they navigate the steps to diagnosis and treatment decisions. Feeders of quality care include a multidisciplinary team ensuring diagnosis and staging. Treatment decisions in line with national guidelines and interventions are supported by holistic psychological, spiritual, physical, and palliative care. As low and middle income countries scale up cervical screening, more cases of invasive cervical cancer will be detected, especially in previously unscreened populations. Therefore, referral and cancer management strategies need to be implemented and expanded alongside prevention services. WHO response. All countries have made a commitment to eliminate cervical cancer as a public health problem. WHO Global Strategy defines elimination as reducing the number of new cases annually to 4 or fewer per 100,000 women and sets 3 targets to be achieved by the year 2030 to put all countries on the pathway to elimination in the coming decades. 90% of girls vaccinated with the HPV vaccine by age 15, 70% of women screened with a high-quality test by ages 35 and 45, and 90% of women with cervical disease receiving treatment. Modeling estimates that 74 million new cases of cervical cancer can be averted and 62 million deaths can be avoided by reaching this elimination goal. Prevention of HPV-associated pre-cancer and cancer is also a key element of WHO's global health sector strategy on HIV, hepatitis, and sexually transmitted infections 2022-2030. In addition to all the prevention means mentioned above, sensitization remains the key factor to remind people of the seriousness of this disease. Participating in Cervical Cancer Prevention Week 2024 is a duty towards the community that everybody should perform. So how to participate in this awareness-raising efforts? There are several ways to get involved and support Cervical Cancer Prevention Week. Share information, spread the word about cervical cancer prevention by sharing information and resources on social media. Encourage your friends and family to learn about the importance of screening and vaccination. Attend a screening. If you are eligible for cervical screenings, schedule an appointment with your healthcare provider. Regular screenings can detect abnormal cell changes early, which can prevent cervical cancer. Support HPV vaccination. Support efforts to vaccinate eligible individuals against HPV, which is a leading cause of cervical cancer. Encourage vaccination for yourself or your children if recommended by healthcare professionals. Organize or attend events. Look for local events, webinars, or workshops related to cervical cancer prevention during this week. Participate in these activities to gain more knowledge and meet others who are passionate about the cause. Donate or volunteer. Consider donating to organizations dedicated to cervical cancer prevention or volunteering your time to support their initiatives. Cervical Cancer Prevention Week has been observed for many years and has played a crucial role in raising awareness about cervical health. And to wind up this program, I leave you with a sensitization ad broadcast by the World Health Organization WHO to fight against this harmful disease. And bye-bye for now.
1,000 lives were lost to cervical cancer, and the problem could soon be much worse. But right now, we can come together to eliminate this cancer for good. If by 2030 we can have 90% of girls vaccinated, 70% of women screened for early signs of cancer, and 90% of patients receiving treatment, in the coming years we can save millions of women's lives.